Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders, past, present, and emerging. Hello everyone, and welcome to Bouncing Back, the Personal Resilience Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I am your host, Joanna. Let's get started. Hey everyone, and welcome back to Bouncing Back. I am your host, Joanna, and today we are going to be talking about the intersection of eating disorders and body image. And joining me today is our guest, Dr. Reza Nejad. Dr. Reza is the director of Sehat Psychology and a registered clinical psychologist with over 20 years experience. He also holds the academic title of clinical senior lecturer with the School of Psychology at the University of Adelaide. Hi, Reza. How are you today?
Good. I'm fine. Thank you. Yeah.
And thank you so much for being with us today. Before we get started, I'd love if you could tell us a bit more about who you are and what it is you do.
Yeah, I'm a clinical psychologist, been working in that field more than 20 years, as you said. I've been seeing patients with different kind of conditions, including PTSD, eating disorder, body dysmorphia, and anxiety and depression.
Great. And I'd love to jump into a section called Have You Met Reza? So here we just get to know you a bit more with some little get to know you questions. So our first question for you is, what is your favorite book?
Oh, then my favorite book is just The Road Less Traveled by Scott Peck.
Okay, interesting. What's that one about?
Oh, it's very interesting book. I think that the first time I saw this book, I read this book, it was around 2005, and really it's just, changed the way I look at the world and, the way that, just interact with other people. It's very helpful. I strongly recommend this book.
Amazing.
Yeah.
I'll definitely check it out. Great. So my next one for you is, what is a movie that you have recently enjoyed?
Oh, I really Joker. Yeah, I love that.
Okay, great.
Yeah. It was very interesting, yeah.
Is that the most recent one?
Yes. Yeah, unfortunately, because I don't have time, I'm not very updated about, movies, but I know that the movie is for 2019, but I didn't have chance to watch the movie, but it's very interesting. I really love that, yeah.
Yeah. It's a good, psychological sort of movie. Yeah,
have you seen that? Yeah. Have you watched?
I have. Yeah, I watched it the one time, and really great acting in that one.
Yeah, exactly. I love that. Yeah.
Yeah, perfect. Well, I've got a couple more here for you. So next one is, are you listening to any podcasts at the moment?
Yes, but then not many, actually. It's just one, and, it's just about soccer, and its name is Football 360. Yeah.
Amazing. What team do you go for?
Oh, then definitely Liverpool. It's my favorite. Yeah, exactly.
Amazing. I'm not much of a soccer fan, but I have a friend who's a big Tottenham fan.
Really? Oh.
Yeah.
Okay, sure.
Yeah, I'm not sure if that's controversial or...
Yeah, then Liverpool. But in Australia, definitely is Adelaide United. Yeah, definitely.
Oh, okay.
Yeah.
Amazing.
Yeah.
Perfect. Well, I've got one more here for you, which is, do you have a role model or anyone that you look up to in your life?
Not really. Not such a role model. But, I just learn from many, many people, just no matter, there are very famous people or ordinary people. I try to learn, but not a specific role model, definitely.
Yeah, that's fair. I think that's totally normal. For me, I don't have a specific or one role model. It's more just different people in my life who teach me things and are inspirational.
Absolutely. They can be your friend. I have got a friend, actually, he's a role model for me. It can be your father. You can, and, sometimes even my son is a role model, the way that he act, behave, how just deal with the problem. Definitely it's my role model. Yeah. My wife, for example. Yeah.
Oh, lovely. Yeah. Those are the perfect role models.
Yeah.
Perfect. Well, let's jump into our topic for today. So we're talking about eating disorders and body image. So first, I'd love to start off by talking about why resilience is important in our lives.
Resilience is just, let's talk about the definition of resilience. Then resilience means being able to adapt to tough situations, then tough situation, or when every time that we face a setback in our life, okay? Then it's just in resilience that we are using our strength, okay, to deal with different problems or issues in our life. When we don't have resilience, then it's going to cause a lot of our problem. For example, people usually with lack of resilience, they try to use drugs, alcohol, even eating, okay, as we are going to discuss, okay, to cope with their problem, okay. But the most important things about resilience that I would like to discuss here is just, resilience doesn't mean not seeking help from other people. Resilience means that, that asking help from others to face a problem and resolve that. In other words, bouncing back whenever you feel a problem and, again, continue despite of experiencing pain, anger, sadness, whatever problems, okay?
Yeah, definitely. And I guess that's why the show is called Bouncing Back as well, because it's all about your ability to come back from hard situations or when you face adversity. Yeah.
Absolutely. And, then because it's something that actually it happens in everyone's life, you might just, get sick or we lost a job or we lose loved ones, okay? It can happen to everyone's life. But it's important that how we bounce back and, face the problem. Yeah.
I'd love if you could share a bit about your personal journey in the field of eating disorders and body image.
Yeah, then it's just, then I'm a credential eating disorder clinician. And since that I got my credentials, I started seeing more patients with eating disorder, And mainly the patient that I see, it's with bulimia, binge eating disorders, and also anorexia, They suffer greatly from other conditions as well, like depression and anxiety. And it has impacted on their relationship and day-to-day life. Yeah.
Yeah. And how do you think resilience fits into the context of eating disorders and when we talk about like body dysmorphia?
Absolutely. Then as I said that, when there is a lack of resilience, okay, then people use, other external resources or drug and alcohol or eating disorder as a way to cope or distract themselves from their problem. Okay. And it's just, that maybe it can help them, for example, like drug, alcohol, even eating disorders, controlling their body in short term. But the problem is in long term, it's just feed more their problems and it causes more problems. And, the problem becomes more pervasive actually.
Yeah. And would you be able to provide any examples or share stories that highlight the relationship between body image struggles and, eating disorders?
Yes, then it's what happens in vicious cycle between, negative body image and eating disorders. Then it means that, because people with eating disorder, they have got very negative body image. They have got subjective, image about their body that actually is different. okay, than what they really have. Then what happened? They over concern about their shape, their body, and this over concern about their shape and body, this negative body image, make them go on diet. And going on diet and using different kind of behavior, like, excessive exercise, and, then using laxative, excessive, using misuse laxatives or other kind of behaviors, actually fuel more and more their negative body image. And it becomes actually a kind of vicious cycle and fuel and feed these negative body image, actually.
Yeah. And how do you think social media and social standards also fuels that sort of negative body image and this negative perception we have of our relationship to food?
Yeah, absolutely. I think that the media have got, especially social media, they have got a significant role in shaping body image perceptions. They just provide unrealistic and idealized body standards in the media that actually doesn't exist, or then it's just they make the people constant exposure to images of pain and can create distorted perception at what we considered as normal. And but the problem is then it's continue, and what they do then, normal people, everyone that who sees things, but sorry, I need to just, it was falling. Then it's what they are doing. It's actually then people start internalizing these images that media provide them. And it's just continue and it increase and feed body dissatisfaction.
Yeah, and I think this idea of normal is really interesting because we're all trying to attain this image of what normal is, when normal is quite subjective. It's not something that is objective because normal looks different on everyone and normal looks different to everyone.
And absolutely. And another problem is that they just showcase unrealistic body ideals, and they perpetuate this notion that our worth is determined by our own appearances and our body. It's another problem that they cause. Yeah.
Yeah, like I know that through social media, especially, there's this culture of associating how you look to how people will value you and how much you're going to be liked by people, and if you're worth anything, and people, associate a certain image to being more desirable by other people. So if you look this certain way, then people will like you more, or you'll get more attention, or
Absolutely.
life will be better for you.
And you would be happier, actually, Yeah, it's another thing that, unrealistic kind of way that just try to to provide this type of information to people every day. Yeah.
Yeah, definitely. And I think to a certain extent that having a certain body image could make you happier, but it has to be what you want as opposed to being influenced by what other people think you should want. So if you have goals, and if you achieve those goals and you look a certain way because you want to look that way and it's healthy for you, then I think that is acceptable.
Yeah, but the thing is, you're right. But there is no just being healthy. Just it's about that how you feel about your body. But when they just try to show everyone that just being thin is just the only way and the only healthy way and normal way to look at yourself, is problematic and causing a lot of problems.
Yeah, certainly. And I'd like to ask you about some of the early signs or indicators that someone might be struggling with their body image.
Sure. One of the main one is that they are preoccupied with their weight, shape, and appearance. They are thinking every day, and actually many times it impacts on their concentration. Okay, they just then actually impact the way that people just do about your daily life, about work, relationship. It's one of them. Then definitely another one is they just constantly feel shame about themselves, and they feel anxious about their shape and body. And what else they do is another unhelpful or maladaptive behavior they do. They compare their body to other people, and many times what they do, they just compare their body to people who are younger than them, or they just do it to unusual subgroup of people, and it's not like that. And actually those people, they usually compare themselves to them. They are not represent the society, just they compare themselves to very thin people, very attractive people, but actually they don't represent the general population. Another the sign for people with this problem, they do a lot of fasting, they just, dieting, skipping meals, misuse laxatives, and, vomiting, purging, and it's another behavior they do, and spending a lot of time or for just, just appearances, too much exercises, constant talk about fat, shape, body. They spend a lot of time, just going social media, Instagram, for example, watching those kind of things. It's one of some of those things that we see that we can consider them as warning signs for people who have got, might have some issue with, eating disorders or negative body image. Yeah.
Yeah, and how can we work towards preventing the development of eating disorders?
Then it's just, are you talking about through media or just ourselves?
I think it's important to start with ourselves, yeah.
Yeah, then I think one of the things is that, I think that it's very important that we get some psychoeducation and, read about eating disorders and talk to a specialist or clinicians who have got area in that area. They have got a specialty in the area as well. And if they see that they are over concerned about their shape and body, or they just overthinking a lot about their body and shape, or they compare to themselves with other people. But one of the things that it's very important, I think, that just help them to just, prevent them from doing that, stop comparing their body to just, anyone else.
Yeah.
And also it's very important, stop body checking. Then body checking actually just fuel or contribute to body dissatisfaction. Because when people do that, they just have got, then it's very over focus on those body parts they don't like, they dislike actually. It's fueled about that. And, and another thing that I recommend you to unsubscribe from any kind of, pages or that it's about people who have got particular body shape, and because it's just constantly give them unrealistic image of their body. I think it's one of those things that they can do, and read books and, just talk about people who have got a specialty in the area, definitely.
Yeah, and if we're talking about social media or us as a society, what can we do to help prevent the development of eating disorders or reinforcing that sort of thinking?
I think that one of them is just about the media. I think that, I think that our family in general, parents, have got a very important role, and social media and the media as well. Then it's very important that just educating about then false belief about, being thin, and just about what weight loss, and and just talking about that, weight gain is horrible and body fat is horrible, or and just try to just emphasize about weight loss. Okay. And what they do, and then the weight loss they just show as a something as indicate as a laziness, for example. Then I think that the media can help a lot in that area. Also, stop or avoid any just categorizing food as a good, safe, bad, unsafe. Actually, that we can do, we can see the media do a lot. And then it's another thing that it's very important, that media this just can do that. And the last thing is discourage the idea that particular diet. And you can see in this media, you can find a lot of information about that as well.
Yeah, certainly. And how can we foster more positive conversations around body image and, as an individual, but also within our society as well? How can we keep having productive conversations?
Yes, I think that one of the things, especially I want to talk about individuals that they might have this, then I think that it's just create a kind of supportive environment for them, okay? Then it's just, they feel safe and feeling unjudged, being unjudgmental about that, and let them know that let them to express their feelings about, then how they feel and about the issue and problem. I think that many people, what I've noticed in my practice, the people with negative body image or eating disorder or body dysmorphia, they're really concerned about how other people think about them.
Yeah.
And they have usually, not all of them, but normally they have usually had a lot of history of being judged, bullied, teased about that. And for this reason, it's very important to provide them, very safe environment to talk about their concern, their fear, and the issue that they have got. I think it's very important. They feel that we are not judging them about how they feel about the problem and their concerns, definitely.
Yeah, and I think that's an important point, like make people feel safe and confident and comfortable that they can talk about this and there's no shame surrounding these topics, because I think what stops a lot of people from talking about it is the shame around it, and they feel like they have to go through this on their own because they can't talk to anyone about it because it's embarrassing, that they're going through something like this.
Absolutely, absolutely. And it's very important, yeah.
Yeah, and I'd like to ask how the intersection of eating disorders and body image can impact our overall mental health.
Then definitely, I think that it's just, then people who have got, negative body image and eating disorders, okay? But let me just once again emphasize that it doesn't mean that everyone who have got negative body image, definitely they are going to develop eating disorders. Okay. And it doesn't mean that people, we have got many people who have got negative body image, but they don't have eating disorders. Okay.
Yeah.
But we know that both can impact on how we feel about ourselves. They can cause different kind of conditions like anxiety disorders, depression, and also low self-esteem. I think it's one of the things that is very common. It's about that they have low self-esteem. They can sometimes they can cause suicidal thoughts and the problems like that. And I think another conditions that it's very, very common among these people is just relationship problems as well. They isolated themselves from other people, and then again it causes more depressive condition and anxiety and stress.
Yeah, perfect. So I'd love to transition into talking about some practices and habits that we can use to deal with this. So is there a specific practice or strategy or tip that you could recommend for managing eating disorders?
Yes, I think for eating disorder is a very complex condition, okay? And for this reason, I don't think that it's like other condition. For example, it's not like, other condition that you can do some certain of, behaviors or a strategy that you can, overcome dealing with your eating disorder. I strongly recommend people who have got eating disorder, they are over concerned about their shape, they are starting checking bodies and also they are preoccupied with their body. They need to see someone, okay, and get help immediately, definitely. It's what I recommend for them. And the
Yeah.
good news is that we have got very effective therapy for that, and many of patients get actually, get recovered from their eating disorders. Yeah.
Yeah. And sometimes I think it can be a struggle to reach out for help. I've seen people in my life go through eating disorders and they go through it in isolation because they don't want anyone to know about it and they don't want to admit that something might be wrong or something might be happening in their life. So if there is someone out there going through an eating disorder and they don't know how to reach out for help or they don't want to, is there anything that you could suggest?
Yeah, then definitely it's understandable. It's one of the issue actually. As I said, they usually being judged about their shape and body, and many of them really embarrassed to talk about, some of their behaviors. But just what I want to just mention that psychologists, they have been trained about that, how to deal with that. Definitely they can provide very safe environment for them to get help as well, okay? But we have got a lot of resources, the online resources. They can go and just get information about that. And I believe that once they get recovered from their eating disorder, their life is going really to change in a positive way a lot. Okay. And for this reason, I strongly recommend them, even if they cannot for any reason, for example, let's say that they don't have that, access to any service providers who provide treatment for eating disorder, I strongly recommend them to just seek help through, just different resources, online resources, and get information about them as well. Yeah.
How do you think that reaching out for help and creating a culture where we can talk about eating disorders more and we can find different ways to cope with it can, develop our perception of eating disorders themselves and, body dysmorphia?
Then how it's going to change the way that we perceive about? Okay, then definitely. Yeah, then I think that, it's going to help a lot because um, when we have got eating disorders, or body dysmorphia, the way that we look at ourselves, it's distorted, the way that we look at our body shape, then the way that definitely, then when they seek help and talk with an, clinician, they can help them to see more realistically about themselves.
Yeah.
And once that happens, then it's like that open a lot of doors for them,
Yeah.
then, and it's actually a turning point in the therapy that I've experienced with many of my patients. So yeah.
Yeah. And I'd love to ask about, a transformation that you've seen, for example, in the patients that you've worked with. Is there something notable that comes to mind?
Yeah, then I think that it's very common among patients with eating disorder, then I think that, then it's many of them, then many of my patients with eating disorder, then when we just do assessment, we see that they, they have got a lot of severe, really anxiety, depressive condition, relationship problems, But after a while, when they just engage in therapy, after, for example, when we start working on a strategy techniques, you just see that how much they have improved, how much they have got a better life, how they just have better relationship with their family, how much it's impact positively in their work environment as well about their productivity and increasing self-esteem. They start socializing more, enjoying being around people, and definitely it's impact a lot positively on their life.
Yeah, great. Well, thank you so much for sharing that with us. I'd love to move into our last section for today, which is our open mic. So I'd love to hand it over to you. We've just created a space for you to talk about whatever you'd like to.
No, I think that, then it's what I want to, maybe it's a kind of, just answering some of your questions. I think that one of the things that it's going to help a lot of, no matter whether they have good body image issue or, body dissatisfaction or eating disorder, what I just strongly recommend that we have got a lot of research showing that mindfulness is helping a lot to managing our anxiety, our depressive conditions, and stress. I recommend it strongly that they seek and they start learning and practicing mindfulness. We have got a lot of resources on the internet, and they can just learn from that. And we have got a lot of classes, and then they can go and seek help about that. Definitely it's going to help them a lot.
Yeah, and I know that you practice mindfulness yourself and meditation. Would you be able to tell us a bit about your practice?
Yeah, then I think that honestly speaking, since I started practicing mindfulness many years ago, I think my life has become more colorful, the way that, then it's help us. It's I think that it's huge impact. Then let me just add that, our mind is like untrained puppy. Okay. And untrained puppies just destroy everything. Our mind wants to go to future, past, and, then when it goes to the future, it makes us feel very anxious, stressed. And when our mind goes to the past, makes us depressed. Okay. And, but the only thing, but not future, not past, none of them really exist. Okay. But the only thing that exists is the present moment. Mindfulness helps you to get control of your mind and stay in the present moment. All these, body image issue, it's just because we are very judgmental about ourselves. We criticize ourselves a lot. Mindfulness actually helps you to accept yourself as you are. It's another benefits that you get from that. Then you become much less judgmental about yourself as well, and actually it's what can give you to make you feel much better and more happy about yourself. Yeah.
Yeah. I love that. That's so inspirational because what you said about the past and the future is so true because none of them actually exist. They only exist in our heads, and our minds are so good at taking us to the future and stressing us out, or taking us to the past and making us sad, when really all we've got is the present and what's in front of us. But not a lot of us are able to be present and anchor ourselves in what's actually unfolding in front of us and make the most of that as well.
Absolutely. And it's the nature of our mind, as I said, it's like untrained puppy. We need to train the untrained puppy. Okay. That, it's exactly like our mind, we need to train that. And the best way to train our mind is mindfulness.
Yeah.
If we can just practice mindfulness 15 minutes a day, it's great. Then it's just help us a lot feel, just feel happier, less anxious, less distressed, and less down, definitely, and less critical against ourselves.
Yeah. And is there a specific meditation or mindfulness practice that you use?
Then what I'm talking about is not a strategy. It's a lifestyle. What I mean
Okay.
that you can be in the present moment through your five senses into present moment, just noticing what's happening, being alert about what's happening inside and our outside, For example, what we hear, what we smell, what we touch, then constant being in the present moment, okay? Or observing our thoughts and emotions as well, then because every day we have got around 7,000 to 8,000 thoughts, okay, that pop into our mind, okay? But they are just thoughts, they are just mental events. The problem is when we see them as a fact, they cause a lot of problem. For example, then I am fat, I'm not good enough. That it's usually the thoughts that pop into the mind of person with eating disorder. They see these thoughts as a fact. But when you practice mindfulness, you see these thoughts as just thoughts. You diffuse yourself from your thoughts, okay? By practicing mindfulness every day, not only you just, focus your mind into present moment about being alert, what's happening around yourself. You are also observing your thoughts as a mental event, okay? Just imagine that your mind is the sky and the thoughts that pop into your mind, they are just clouds. They are coming by, going by, rather than just attached to your thoughts. Then you act like a Teflon, okay? Not a sticky to anything. Let them go, let them go. Or, then it's help you actually rather than to get caught up with your thought. Let them go, detach yourself from your thought. Then definitely it's going to help them a lot.
Great. I love that. And I feel like that's a really great ending note. Think of your thoughts as passing clouds as opposed to this cloud that's going to hang over you and make you obsess and stress and be sad.
Absolutely. Because, the reality, they are just mental events, they're nothing more than that, okay? Or many times I just, for diffusing themselves from the thoughts, I ask them to tell them, thanks for sharing, rather than, then it's just there because they are just thoughts. They are popping and, just keep telling ourselves a lot of negative things, but it's important we see them as thoughts, not as a fact.
Yeah, 100%, because we think that everything that comes into our mind must be a fact. It must be true. And all the bad things we think must be real because we're thinking them. We're not thinking them for no reason.
Exactly.
So, yeah.
Absolutely. Yeah.
Great. Well, thank you so much, Reza, for coming on the show and sharing your knowledge with us.
Yeah, my pleasure. Absolutely.
Great. Well, for those of us who want to find out a bit more about your work and what you do, where can we go?
Then I think that, they can definitely just search my name, Reza Nejad, or our practice is Sehat Psychology. We provide video calls and face-to-face appointment. We just work in different area such as eating disorder, dysmorphia, body dysmorphia, anxiety, PTSD, and depression. They can just Google Sehat Psychology, SEHAT Psychology, and definitely they can find us on the internet. Yeah.
Brilliant. Well, for those of you who missed that, we've got Reza's details down in the description below. And thank you so much for tuning in, and we'll see you guys next time. You have been listening to Bouncing Back, the Personal Resilience Science Insights podcast produced by the Life Management Science Labs. Listen to episodes from LMSL's 10 Life Management Perspectives on Apple Podcasts, Google Podcasts, Spotify, YouTube, or other podcasting apps on your smartphone. If you enjoyed this episode, please consider rating our show, sharing it, and subscribing to our channel, as it helps other people find it and us grow to bring you more quality resources. More of our work can be found on our website, pr.lmsl.net, where you can join our movement. I'm Joanna. Thanks for tuning in.